But we begin with a look at Canada and COVID-19 through the U.S. lens. Why did the third wave hit this country so much harder? Dr. Anthony Fauci is the chief medical advisor to the U.S. president. He's also the director of the U.S. National Institute of Allergy and Infectious Diseases. Dr. Fauci, special privilege to have you on the program. And I must say, for months, we Canadians were looking south and thought, thank goodness we're not down there. And now, as you've got more and more vaccines into arms, proportionally far more than we have in Canada, our hospitals now being overwhelmed, I'm wondering what's going through your head when you look north.
Well, you know, what goes through my head when I look north is not that Canadians are doing anything wrong or making any big mistakes at all. What goes through my head is how extraordinarily difficult this virus has been globally. You know, when the United States was getting hit very, very badly, we had three major surges. One that went from the fall through the early winter, where at one point we were having 300,000 new infections a day, similar to what India is doing now. And we were having 3,000 to 4,000 deaths per day. Now that we're rolling out and implementing the vaccine program in a very successful way, back then when we looked at India, India was doing well. They had a little blip, but then it came back down. And everyone asked, gee, how come India has done so well and the United States has done so poorly? Now that we're doing well and you look over at India, they're terribly suffering from this. So the message is that this virus is a terrible virus. We've got to do everything we can, from public health measures to the implementation of what vaccines we have available. That's really the message.
You've brought up the issue of India. Canada has a ban on flights coming from India. The United States set to introduce one in terms of arrivals from most non-U.S. citizens. I wonder, though, there is a discussion here about whether we should be closing our land borders or demanding that people who come in through those land borders actually go into a hotel for 14 days, for 3 days, as is required at our airports. I just wonder where you think we stand in terms of North America broadly. If people now can't come from India into the United States and then transit across the border essentially on foot, is there much of a need to control that Canada-U.S. border in the same way to protect against variants?
You know, I would prefer not to comment on that because that very much becomes a country-specific, even a political issue. And I think that at least the colleagues that I know in Canada, the health officials, are competent enough and good enough to advise the Canadian government about what the most appropriate public health approach would be. Because what happens is if I say something in one direction and it's in conflict with what a Canadian official says, that I wouldn't want to get into that type of thing. The Canadian health officials are very competent to make that kind of advice.
You, though, of course, are advising the U.S. government on such things as the Canada-U.S. border. A lot of people trying to speculate when that might be open. Do you have any thoughts?
No, I'm not sure. That is certainly something that is continually discussed, not necessarily by me, but by people in the State Department and in the Department of Homeland Security. So I haven't had the opportunity to get into deep discussions about the situation at the Canadian or the Mexican border.
Given where the United States is in terms of its vaccination efforts and this now push by the CDC to relax some restrictions, beginning with the suggestion of wearing the recommendation to wear masks outside, where do you see us broadly heading, if not Canadians, then Americans? Where are we heading in the summer and the fall in terms of those restrictions?
Well, that's an obvious, excellent question that everyone is asking. What our approach is to get as many people vaccinated as quickly as we possibly can. We've been very fortunate in that we now have 100+ million people in the United States that are fully vaccinated, well over a third of the adult population, and over half of the adult population has received at least one dose. Our concern about the elderly has been alleviated somewhat by the fact that we have 80% of our people over 65 who have had at least one dose, and 65% of those are fully vaccinated. So our policy is to get as many people vaccinated as quickly as you possibly can. And without a doubt, the level of daily infections, the 7-day average of daily infections is going to dramatically diminish. We were up at around 60,000 per day as the 7-day average several weeks ago. It is now starting to gradually come down. We're now at around 52,000, down from 60,000. Once you get much, much lower, you're going to see a relaxation of some of the restrictions and guidelines that are put on people who are vaccinated. And in fact, we saw the CDC come out 2 days ago with some of the things that vaccinated people can do outdoors now without a mask, and some of the things that they can do indoors with a mask. So as the weeks and months go by, as we approach summer, and as we get more people vaccinated, and we get a lower level of daily infections, you're going to see an even greater relaxation of some of the restrictions and guidelines that are put upon people who have been vaccinated in the United States.
So in the United States, who or what gets the credit for that? Is it just that you had the supply of vaccines, far more, say, than we did here in Canada early on? Or is it the result of the new administration? What's the contributing factor in your mind?
You know, it's a combination of both. It was Operation Warp Speed, which planned to have a considerable number of vaccines already ready to be deployed.
And that was begun under the Trump administration.
Yes, absolutely. I think it's fair to give credit to the Trump administration for Operation Warp Speed. But the implementation in the first 100 days of the Biden administration has been extraordinary in a very successful way. You know, no one would have thought that we would have been able to get 3 to 4 million people per day vaccinated, and now we're between 2 and 3 million, where you have up to 30 million vaccines per week being brought and ready to go into people's arms. I don't think anybody would have anticipated or predicted that we would have been this successful. And that really is a testimony to the extraordinary effort that the Biden administration has put into the implementation of the vaccine administration program. So it's a combination of two things: the really good effect of Operation Warp Speed in the prior administration, and the really good effect of the implementation of the vaccine distribution program in the current administration.
I want to ask you about the AstraZeneca vaccine, approved here in Canada, in use here in Canada, not approved, not in use in the United States. You've sent us some of your AstraZeneca, which is how we've got to the point that we're able to vaccinate more people. But some of those people were reluctant to take it, quite frankly, and are now wondering about their second dose and mixing vaccines. Where do you stand on the idea of, if you had your first dose as AstraZeneca, the idea of having Pfizer or Moderna for your second?
Well, there's no scientific data at this point that says that that is going to be the optimal way to get your optimal immune response. We do know that if you take your second dose of AstraZeneca, then there are studies to show that that does work, and that's an efficacious vaccine. Studies that were done in England and studies that were done in the European Union. So the recommendation would be, if possible, get the dose that is the boost, similar to the dose that was the prime.
Can I just ask you very quickly on the idea of sharing more vaccines? Clearly, Canada had a slower start than the United States did. We are now beginning to see the floodgates opening more, but they would open even more if the United States were to once again, as it's planning to do, share 60 million vaccines. Any sense of whether those might be headed to Canada?
You know, I really don't know. I'm not holding back information from you. I'm not really aware of what exactly the distribution mechanism is going to be.
Where would you like them to go?
Well, I would like them to be distributed as equitably as possible. You know, when you only have 60 million doses and you have so many countries that need it, one of the ways to try and get equity would be to give it to the COVAX organization, and try to get to them to be distributed. Or in situations of dire need, you might want to give it to individual countries. So that decision has not yet been made. There are multiple options.
Would India be one of those countries, given the state that it's in right now?
I think certainly India would be considered as a very high priority, given the desperate situation that they're in right now.
Dr. Fauci, thank you so much for your time. Have a great weekend.
Thank you very much for having me. Good to be with you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.